So in our analysis that we released this morning, we pulled data on country level vaccinations and looked at trends by income group and by region. And I want to give credit to the rest of the team at KFF that worked on this as well, including Anna Rao, Adam Wexler, and Jen Cates. The findings here, I think, speak for themselves. While over 50% of the people living in high-income countries have received at least one dose of a COVID-19 vaccine, in low-income countries, that number is 1%. On the chart on the right, you can see that there is a green line, which is almost indistinguishable from the horizontal axis, and that is the progress on vaccination in low-income countries. And that is the crux of the challenge that just represents the scale of the income of the vaccination access gap that we're talking about. So in fact, there's just 3 countries, that China, India, and the United States, which account for 57%, so more than half of the vaccine doses administered globally at this point to date. So one note about this chart, you might note there's a little jump there. That's an artifact of the data coming out of China. China reported all at once a number of people vaccinated in June, and so the numbers reflect that data reporting issue. So one reflection of this restricted access to vaccines among low-income countries is that in these countries, even the highest priority groups have not been vaccinated at this point. So this chart comes from Philip Schelikins, who works at the World Bank. He analyzed vaccination rates in countries by income group among healthcare workers and seniors, which we across the world agree universally should be the first in line to receive a vaccine. But we can see that in low-income countries, far less than half of healthcare workers and seniors, the highest risk groups that are most in need of vaccination, have been reached with vaccines. And if you break this down by different countries, even that distribution can range from very, very low numbers, almost 0% of this high risk group that's been reached. So as Nahid mentioned in her comments, now that we're seeing the Delta variant increase the number of cases across many regions, and particularly in Africa and parts of Asia, the lack of access among the highest priority populations is a very big concern. It speaks to the immediate need for vaccination, not just the general population, but for the highest risk populations.